Thank you.
I do want to talk to you about some things off record, okay? Me and you.
I do want to show
That's not what you texted me. Anyways, no.
I want to show you for 406.
The House Health Policy will come to order. Would the clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett. Carter.
Here.
Hadsma.
Present.
Neely.
Here.
Glanville.
Here.
Kafia.
Here.
Conlon. Here. Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reingans.
Here.
Vanderwall.
Present.
Filler.
Yes.
Mueller.
Here.
Van Workum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson.
Here.
Madam Chair, you have 18 members present. You do have a quorum.
Thank you. Representative Fitzgerald moves to approve the minutes from our meeting on May 11. Seeing no objection, the minutes are approved. Today we will be voting on HB 4071. We will then hear testimony on House Bills 4495 and 4496 and voting on HB 4495. Finally, we will take up Senate Bill 59, sponsored by Senator Cherry, that would add conservation officers to the definition of peace officer in the Mental Health Code. First up on our agenda, we will be taking up HB 4071, which we heard incredibly moving testimony on last week, and I think we have a card to read in on that one from American Lung Association in support of the bill. I see that we have an amendment from Representative Vanderwall on HB 4071, which you should have received at your places, members. Representative Vanderwall, would you please explain the amendment you are offering today?
Thank you, Madam Chair. Yes, this amendment basically, if the manufacturers of these anti-cancer medications have increased their prices of their drugs more than the cumulative annual charge in the prescription drug index of the medical care component of the United States Consumers Price Index. So basically, if the price goes up considerably more, it would be exempt out. So that's where we're at.
Thank you. Do we have any questions from members on the amendment? And I will just say, it's not that I am opposed to this amendment. I just prefer folks to work with the bill sponsor. With that, we will, Representative Vanderwall moves to adopt the amendment to HB 4071. Will the clerk please take the vote?
Chair Rogers.
No.
Representatives Whitsett. Carter.
No.
Hadsma.
No.
Neely.
No.
Glanville.
No.
Kafia.
No.
Conlon.
No.
Farhat.
No.
Fitzgerald.
No.
Miller.
No.
Reingans.
Nope.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 7 yeas, 11 nays, 0 pass. The amendment is not adopted.
With that, I will entertain a motion to report House Bill 4071. Representative Miller moves to report HB 4071 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett. Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
No.
Filler.
No.
Mueller.
Yes.
Van Workum.
No.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 14 yeas, 3 nays, 1 pass. House Bill 4071 is reported with recommendation.
Ensuring affordable access to oral chemo is vital and it has been considered for far too many years now. I am encouraged that this will be the year that we will finally join nearly all other states in the United States and eliminate the disparity in costs between oral and IV chemotherapy so that Michiganders fighting cancer can have access to the best options and a higher quality of life during treatment. Next up, we will hear testimony on House Bills 4495, introduced by Representative Snyder, and 4496 from Representative Filler, that would eliminate unnecessary language from the Healthy Michigan Plan. After hearing from the bill sponsors, we are fortunate to have MDHHS Director Elizabeth Hertel joining us today. Finally, we will hear from Dr. Michael Redinger, a psychiatrist and teacher in the Department of Psychiatry and Department of Medical Ethics, Humanities, and Law at Western Michigan University. Representative Snyder and Filler, if you are ready, please start whenever you would like. Thank you for joining us.
Thank you. Good morning, Madam Chair and members of the committee. Thank you for allowing me the opportunity to testify and for taking up House Bills 4495 and 4496, also known as the Healthier Michigan Plan. I am here today to explain House Bill 4495 and share why this legislation is vital to my district and those I represent. 10 years ago, almost to this day, it was June 13th of 2013, the House of Representatives, in a nearly unprecedented bipartisan fashion, expanded Medicaid eligibility to 138% of the federal poverty level by adopting the Healthy Michigan Plan. The Healthy Michigan Plan has helped millions of Michiganders access essential health care services. In Muskegon County, which Representative Van Workum and I both call home, just over 16,000 individuals are enrolled in the Healthier Michigan Plan. According to independent research from the University of Michigan, the Healthy Michigan Plan has more than doubled primary care usage, reduced enrollees' reliance on emergency room by over 58%, and cut uncompensated care by nearly 50%. The goals set by the legislature when expanding Michigan's Medicaid program were to lower the state's uninsured rate, reduce uncompensated care, and save tax dollars. Since adopting Healthy Michigan, Michigan's uninsured and uncompensated care rates have dramatically improved. Additionally, general fund savings have been produced yearly since the program was put in place. As we near a decade of experience, some program improvements and modernizations are warranted. Coverage and access barriers must be proactively addressed to improve health equity. To protect enrollees' continuity of care coverage and advance health equity outcomes, House Bill 4495 would remove administrative cost-sharing requirements on enrollees that could jeopardize access to care and cost taxpayers more than it could recover from enrollees on the program. Modernizes health risk assessments by allowing greater flexibility for the department and the health plans to incentivize improved health outcomes. Prioritizes health equity and improve healthy outcomes as a means for Medicaid health plan performance review and incentives. Lastly, considering more than $1.2 billion in general fund savings have already been realized, House Bill 4495 would remove the existing repealer trigger if the program costs to the state should ever eclipse the annual state savings from the program. In summary, House Bill 4495 broadly simplifies the statutory language around Healthy Michigan and removes language that could jeopardize the program from ending if certain cost share conditions are not met. I thank the committee members for the time and willingness to consider this important legislation. And now I'm going to turn it over to Representative Filler.
Thank you, Rep. I'm happy to be part of the bills. Basically, these are modernizations to the Healthy Michigan. And House Bill 4496, which I sponsored, deletes outdated language and also provides contracted Medicaid health plans the flexibility to improve health outcomes with incentives and strategies. There is language in my bill dealing with dual eligibility participants, and I believe that that language will be removed as we move forward with my bill because it's not the bill's main focus, and I don't want it to slow down important bills. But you're going to hear from basically the entire medical field in Michigan today, believing that the provisions that we're repealing haven't led to cost savings, they haven't improved health outcomes, and are an unnecessary government burden. I do kind of want to discuss one of those aspects. You know, you go in and you do an HRA, and you click the stop smoking box, and if you stop smoking or not, it doesn't impact your insurance. It just adds an extra bureaucratic step, and what physicians do is health risk attestations. That's what they do every time. They meet with an individual and they get a feel. So why are we adding sort of this unnecessary government bureaucracy that hasn't actually helped Michiganders? And that is my bill, and I ask for your support.
Are there questions before we move on to additional testimony? All right, thank you so much. Next up, I am happy to welcome Michigan Department of Health and Human Services Director Elizabeth Hertel to Health Policy to talk about why this issue is so important and timely. Good morning, Director Hertel.
Good morning. Good morning, Madam Chair and members of the committee. Thank you for inviting me this morning to talk about Healthy Michigan moving forward. As you know, Healthy Michigan was passed in 2013 with broad bipartisan support, along with support from business organizations and healthcare organizations alike. On April 1st, 2014, the Department of Health and Human Services launched the Healthy Michigan Plan to extend healthcare coverage to eligible residents up to 133% of the federal poverty level. Today, over 1 million residents are receiving affordable and comprehensive healthcare coverage through the Healthy Michigan Plan. Legislation passed in 2018, which required the department to seek approval from the federal government to require healthy behavior completion and increase cost sharing for individuals between 100 and 133% of the federal poverty level who have had 48 months of cumulative health care coverage through the Healthy Michigan Plan, as well as implementing work requirements as a condition of eligibility for able-bodied adults ages 19 to 62. However, in spring 2021, the Center for Medicare and Medicaid Services formally withdrew the state's work requirements as they would not promote the objectives of the Medicaid program. CMS's approval of the healthy behaviors and cost-sharing provisions, which have yet to be implemented due to the public health emergency, are currently being challenged in federal court. The parties to the lawsuit filed a joint motion to extend the stay of the case until July 15th of this year. The court granted the motion and entered an order extending the stay and requiring the parties to submit a joint status report by June 30th. House Bill 4495 would broadly simplify and streamline the statutory language around Healthy Michigan and eliminate the aforementioned healthy behaviors and cost-sharing requirements and time limitations, instead providing the department with the flexibility to establish and adjust cost-sharing as appropriate and permitting the department to incentivize healthy behaviors rather than condition eligibility to be completion of those behaviors. I appreciate your consideration of this bill. There is no doubt that Healthy Michigan has been a success for our state. It has resulted in savings, reducing our state's uninsured rate significantly, and has improved the health and well-being of our fellow residents by empowering them in their personal lives. Thank you.
Thank you for your testimony. Members, do we have any questions for Director Hertel? Okay. Next up, we have Dr. Michael Redinger on behalf of the Michigan State Medical Society's Legislation and Regulatory Policy Committee to speak in support of the bills. Dr. Redinger will be joining us remotely, so please proceed when you are ready. Welcome.
Thank you very much. Can you all hear me?
Yes, we can.
Well, good morning, Chair Rogers, Vice Chairs Wissett, Vanderwall, and members of the House Health Policy Committee. My name is Dr. Michael Redinger, and I'm a board-certified psychiatrist, member of the Michigan State Medical Society Board of Directors, and chair of the MSMS Committee on State Legislation and Regulations. I also serve as an associate professor at the Western Michigan University Homer Stryker MD School of Medicine, where I'm duly appointed in the Department of Medical Ethics, Humanities, and Law, for which I serve as co-chair.
Go Broncos.
In the Department of Psychiatry. Can you hear me?
I apologize for interrupting. I said go Broncos.
I'm sorry, can I proceed?
Yes, you can.
So I am here today to voice MSMS's support for House Bill 4495. Before the passage of the Healthy Michigan Plan by the state legislature, 1 million fewer of our friends and neighbors had access to affordable healthcare coverage. That's 1 million fewer people who could access mental health care, 1 million fewer people with maternal and newborn care, 1 million fewer people with wellness services and coverage for chronic disease management. Doctors want to care for patients. We want patients to be able to access care without fear of financial ruin, and we know that inadequate insurance coverage is one of the largest barriers to accessing healthcare. That's why MSMS supported expanding Medicaid when it originally passed. And while the Healthy Michigan Plan is exceeding its goals of reducing Michigan's uninsured and uncompensated care rate, outdated mandates on enrollee cost sharing and healthy risk assessments continue to create barriers to accessing coverage and care for Michigan's most vulnerable populations. Moreover, the embedded sunset provision would, if triggered, eliminate healthcare coverage for over 1 million Michiganders. In our pursuit to provide the best possible care and best outcomes for our patients, it is important to acknowledge that when patients are unable or unsure how to access health coverage or lose their health coverage, adverse health outcomes are the result. When a process is too confusing, burdensome, and costly to navigate, too many people go without. Data from the Kaiser Family Foundation indicates that even minimal cost-sharing burdens decrease access to essential care for conditions like hypertension and childhood asthma, and that those with the lowest incomes are most likely to feel the burdens of cost-sharing. And according to a recent study by the University of Michigan Institute of Healthcare Policy and Innovation, when patients gained healthcare coverage through the Healthy Michigan Plan, primary care usage more than doubled, reliance on the emergency department as regular care decreased by nearly 60%, and uncompensated care was cut by nearly 50%. My wife is an emergency medicine physician, and as a hospital-based psychiatrist myself, we often see patients together when they come to the emergency department in a mental health crisis. We know that many of those patients' costly visits are preventable when they're able to access mental health treatment through their primary care physicians. Those patients are able to access antidepressant medication sooner in their depressive episode, get better more quickly, and avoid the situation getting worse enough that they need to come to the emergency department because of a mental health crisis. My colleagues and I are able to promote regular checkups, screenings, and other healthy behaviors. We are able to diagnose health problems sooner and help reduce the burden of chronic disease and improve overall health outcomes. House Bill 4495 will further strengthen the Healthy Michigan Plan by removing outdated cost-sharing requirements, allow health plans more flexibility in creating incentives for patients who practice healthy behaviors, and ensure that Michigan's Medicaid population will not go without coverage. The time is now to ensure these vital reforms to Michigan's healthcare system and to law and create a healthier Michigan for all its citizens. For these reasons, I strongly urge your support of House Bill 4495. Thank you again for having me. I appreciate your willingness to allow me to testify virtually, and I'm happy to answer any questions.
Thank you, Dr. Redinger, for bringing the perspective of a medical professional to this legislation. Do members have any questions for Dr. Redinger? Okay, thank you so much. Next up, we have Dominic Pallone wishing to speak from Michigan Association of Health Plans. Welcome.
Thank you, Madam Chair, and thank you to members of the committee. I'll be very brief because I think the doctor and the previous testifiers, the sponsors, said everything really well. I'm Dominic Pallone. I'm the executive director of the Michigan Association of Health Plans. We represent 11 health insurance companies that are licensed and operate here in the state of Michigan, providing coverage for well over 3 million Michiganders, many of which are in the Medicaid program and many of which are in Healthy Michigan. I just want to start by thanking the sponsors for their effort on this and thanking the department and the chair and members at General here on this committee for their attention to this issue. As you've heard in previous testimony, we also believe that the Healthy Michigan program as a whole has been a tremendous success on all fronts for the people of Michigan. As partners in this process, Medicaid health plans are contracted with the state of Michigan to help deliver services to this population, and we agree with all of the changes in these bills, as was referenced to the health savings account, health risk assessments, simplifying the bonus incentive program, deleting some outdated provisions, and deleting previous old reporting or special committees references that had concluded their business in the state. Happy to take any questions, but on behalf of our members, we very much appreciate the effort and the time here today. Thank you.
Thank you. Do members have questions? Representative Carter, and then I see Rankins.
Just one question. You are supporting this, correct?
Absolutely.
Thank
Yes.
you.
Yes.
Representative Reinkens.
Thank you, Madam Chair. I wanted, since you're pretty well versed in the insurance world, I just wanted to point out at the end of Bill 4496, there is a section that repeals MCL section 400-107A and 400-107B, which is the work requirements, which we previously voted on and passed out of this committee. It was unfortunately a party line vote. I'm wondering if there's any difference here today, or is that like basically the same?
I appreciate the question, Representative. I think that that is something being cleaned up in a substitute that I don't know if the committee has been
Well,
adopted.
I can speak to that if that's
Oh,
all right, because I
yes,
think
please,
that's my
sorry.
bill. We're going to remove that from this bill so that it doesn't cloud the bill in general. We want the focus to be on cleaning up Healthy Michigan and gaining support for those changes. So
I personally would love to see this remain in the bill, to repeal it twice if we can, if we have to, because I really hate the work requirements. So,
I would support that as well, Representative Reinkens.
so just for the record.
all right. Well, I do want the focus of the. I don't want anything to slow down because I do support both bills, and so that would be my recommendation when we put together a sub for 4496.
Thank you so much.
Thank you, Rep.
All right, seeing no further questions, we appreciate everyone who gave testimony today on HB 4495. Representative Neely moves to report HB 4495 with recommendation. Madam Clerk, please take the vote.
Chair Rogers,
Yes.
Representatives Witsett, Carter,
Yes.
Hadsma,
Yes.
Neely. Yes. Glanville,
It's not her fault, it's y'all's.
Glanville,
Yes.
Kafia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
Pass.
Filler,
Yes.
Mueller,
Pass.
Van Workum,
Pass.
Roth,
Pass.
Schmaltz, Thompson. Madam Chair, you have 12 yeas, 0 nays, 6 pass. House Bill 4495 is reported with recommendation.
Thank you. And I was so eager to get to the vote. I apologize. I didn't read the cards in. My mistake. So I've got Trinity Health Michigan supporting HB 4495 and 4496. Blue Cross Blue Shield supporting both bills. Rory Lafferty from HAP supporting both bills. McLaren Health Plan supporting both bills. Molina Healthcare supporting both bills. AARP supporting both bills. Meridian supporting HB 4495. Michigan Council for Maternal and Child Health supporting both bills. Michigan League for Public Policy supporting HB 4495. Michigan Health and Hospital Association supporting both bills. And the Food Bank Council of Michigan supporting both bills. I do not believe we had any in opposition, correct? Thank you. All right. And one more that was emailed in from the Center for Civil Justice, and they are supporting both bills. Finally, on the agenda, we have Senate Bill 59, which would add conservation officers to the definition of peace officers in the Mental Health Code. And speaking to the bills will be the bill sponsor, Senator Cherry, followed by Taylor Ritterbusch from the DNR. And finally, conservation officers, Chief Dave Shaw and Sergeant Damon Owens. Senator Cherry, welcome to House Health Policy Committee, and begin when you are ready.
Thank you, Madam Chair, and members of the committee for bringing this bill up. It's a fairly simple bill. Senate Bill 59 modifies definition of peace officer in mental health code to include any officer or law enforcement agency who is licensed under MCOLS. This change was prompted by conversations with the DNR who are not currently covered under the current definition. By adopting this change, we'll be giving conservation officers the same authority as peace officers, allowing them to put people that are in a mental health crisis, require them to get a evaluation. So conservation officers protect our natural resources across the state, both on state land and perform general law enforcement duties. And while many residents enjoy these beautiful spaces, unfortunately, sometimes there are individuals in crisis that often choose to harm themselves or end their life in these beautiful and oftentimes isolated places. When a conservation officer intervenes in these circumstances, they do not have the same powers to require or take necessary actions to help those individuals. And this bill, if enacted into law, would change that. And we have some conservation officers here who can kind of testify to actual real-life situations in which this has come to be. So with permission of the chair,
You all came forward, which is great, and we will be efficient and just go right down the line if that's fine with you all.
Great. Thank you, Madam Chair, members of the committee. Again, my name is Taylor Ritterbush. I'm the legislative liaison for the DNR. Just wanted to say thank you to Senator Cherry for working on this bill with us. It's something that that our law enforcement division has been looking forward to working on for a long time. As Senator Cherry said, oftentimes they come across individuals that are in the process of attempting to harm themselves, and without having the proper recourse provided to them through the mental health code, in some situations they're unable to help them. So with that, I'll pass it over to Chief Shaw and Sergeant Owens to talk about their real-world experience with this issue.
Thank you, Madam Chair, committee members, Senator Cherry. My name is David Shaw. I'm the chief of the Law Enforcement Division. We have 252 sworn uniform officers that are MCOs certified. We have statewide jurisdiction and statewide authority with the exception of this area of concern. Our officers are in every county of the state of Michigan, and quite often in some of our more rural areas in northern Michigan and the Upper Peninsula, our officers are the community law enforcement that are on shift many times late at night or backing up other agencies. As chief of the agency, my concern obviously is the citizens of the state of Michigan, but my concern is also the welfare of our officers. When a mental health crisis happens and our officers are on scene in dealing with that event, not having legal authority to take a person into protective custody for their safety also places my officers both at risk, safety-wise, but also liability risk. So thank you for your time. I'm going to pass this over to Sergeant Damon Owens to speak to some real-life experiences. Thank you.
Good morning. Thank you, Madam Chair and committee members. My name is Sergeant Damon Owens. I am a supervisor for the DNR Law Enforcement Division, most likely and all the time is in Southeast Michigan, specifically Wayne County, and our state park in Wayne County is Belle Isle State Park. I hope you all are aware of that one. It's a beautiful park. However, in situations, I have and will come in encounter with individuals who are going through a mental crisis state. And a lot of times we have to use our verbal judo to bring this person down and have them self or volunteer to go to a hospital for a medical evaluation. Other times we will have to call for another agency to come in so they can petition this individual for assistance, which I have experienced where when that happens, the individual becomes more irate because now more officers are showing up and it's hard to have them volunteer. So either they act in a way where the other officer will be able to put them in protective custody, or unfortunately we have to let them go. And then we find out later maybe something happened down the road that we could have prevented. Working on Belle Isle has opened my eyes to a lot of situations. It's a beautiful park, and unfortunately some of the individuals down there run into mental crisis, and that's where they want to go, to a beautiful park to jump off of the bridge, the Belle Isle Bridge, overdose on drugs. And although the bridge is not that high up, it has a very significant current. And once the individuals hit that water without a recovery in process or a rescuing process, it'll be a recovery later on down there, the Ambassador Bridge or further downriver. If we had this authority to do that, we would be able to fully feel confident that we can place this individual in protective custody for their safety and for ours, and try to at least have the manner to get them the proper help that they could seek out. I'm willing to answer any questions. I have several unfortunate and fortunate life experiences if you'd like to hear those as well. Thank you.
Thank you for all of your testimony. I think we have several questions started, so I will start with Representative Mueller.
Thank you, Madam Chair. This makes sense. I just want to make sure that everyone's clarified that you guys go through this kind of mental health training through the academy too, just like state police and other police officers do. So you have that type of training to make those types of determination. Is that correct?
Yes, that is correct.
So it would make sense for you guys to be able to do this.
Yes.
And I'm supportive, just letting you know.
Yeah, we have this, really, our training hour-wise is a little bit more than the state police because of some of the other regulations we enforce, but our MCO's academy is exactly the same as state police as far as required course. Thank you.
And just a quick follow-up, I would just like the members to know also that with the DNR, you have to remember every time they go to a call, you know, every time a police officer goes to call, there's a gun. But when they're going into the woods, they're going into the woods where there's people that may be mentally ill, carrying firearms. So every call they go to, the other people always have guns. Versus when a police officer goes to call, a lot of times it's the police officer that has a gun. So they're actually in pretty dangerous situations, and they need to be able to have the tools and things that regular police officers do to mitigate those circumstances. Thank you.
Thank you.
Representative Rankins.
My comment was going to be really similar to Rep. Mueller about the training and what was different between your training and state police, but it was answered. But I do want to remind everybody that when we're in a health policy committee, DNR means do not resuscitate. So it's really playing with my mind here to hear you talking. So thank you for being here today.
Representative Fitzgerald.
Thank you, Madam Chair. Out of curiosity, and thank you for describing the training that goes into this, but with this reclassification or the definition that brings the, your organization in, are there continuing education requirements or professional development requirements that you would now be subjected to that you may not have been before with this new classification?
I don't think as far as required, but as you know, mental health is very important to law enforcement, and we are very proactive in our training. As a matter of fact, we've gone to a couple of trainings in the last year on that, and it's something that is very much a current and developing topic in law enforcement, to the point where a lot of the calls that we have that are for service have to do with a mental health component to it. So yes, sir, we would continue training.
Next up, we have a question from Representative Conlon.
Thank you, Madam Chair. I'm just very happy to hear about this. I lost a beloved cousin in a park to suicide, and the conservation officer watched him sitting there for half hour, 40 minutes, knew he was in major distress, approached a couple times, couldn't get him to talk about it, and couldn't call anyone because he wasn't making a disturbance, and unfortunately was there and witnessed him pull out the firearm and take his own life. And he's traumatized by that because he felt like he could have done something. And so thanks for this.
Thank you for that, Representative, and I am sorry for your loss.
Thank you for sharing, Representative Conlon. And I guess this is Mental Health Week, because I do want to thank Chair of Military Veterans and Homeland Security, Conlon. We're having discussions about mental health supports for our veterans in her committee as well. So I'm sorry for your loss as well. My question following up on that, and then I'll get to Vice Chair, is there supports for you all? So just like law enforcement that I'm sure Rep. Mueller could speak to, you all have some mental health issues with what you all witness. What supports are there in place for you all currently, and does more need to be done to help you all?
It's an excellent question. Thank you. Yes, we do. As a matter of fact, we had an individual maybe a month ago, officer had to deal with this same situation, and we do have legal representation and mental health, as well as our partners. We call each other, depend on each other. There's a lot of law enforcement families and agencies that you can go to and talk to. As a matter of fact, I have one of the care cards somewhere on my person that a handout to another officer and whatnot. So, and as far as to speak to the training, we go through 26 weeks of training at the Michigan State Police Academy right next to a trooper. So we just have to stay a little bit longer because we have to learn about all the lovely natural resources.
Thank you. Vice Chair Vanderwall.
Thank you, Madam Chair. And again, thank you guys for being here. I truly do appreciate it. When we look at a DNR officer in today's world, things have changed dramatically, especially probably over the last 10 years with the shortage of everyday state troopers, sheriffs, and city police. So you guys get called in on a lot of cases that you normally would not be brought into. Is that correct?
Yes, that's correct. And all of our officers are a very important part of the law enforcement community within the counties.
So is there any other aspect inside law enforcement that you don't have equal opportunity to address? So right now you can't address or make that call on mental health. Are there other things that we're lacking inside our department? Or is this really the number one piece that needs to get addressed right now?
Representative, this is the number one piece, and no, we have the same authority and jurisdiction as state troopers with the exception of this. I quite honestly believe at the time it was an oversight due to we've seen this before, confusion over peace officer status.
Very good. Thank you.
Thank you. Representative Schmaltz.
Thank you, Madam Chair, and thank you for your testimony. I'd just like to know, I've been to Belle Isle many times, very beautiful. How much has this increased? Are you seeing a big increase? How often do you face this?
Yes, unfortunately, it seems to be becoming more and more because it's a place of peace, more so now. And speaking with individuals, they could be a veteran, they could be a homeless individual. It could just be a mom of 5 having a bad day, and they wanted to come out and have a peaceful way to go somewhere. And I just advise you're not going somewhere here. We're going to get you the help that you need. And most of the time, we're successful. It's just the fear that the ones that were not successful, and then we hear later on the news, and maybe it was a situation that I or one of my partners were involved in, and the first thing we think is we could have done something about that.
And how often does this happen?
Well, I can tell you any given beautiful day, and today's a gorgeous day. So let's just hope that everything is going okay down there now. But it does happen quite a bit. From my first testimony with the Senate, which was prior to Thanksgiving, and I had dealt with probably 4 incidents while preparing for our testimony.
Okay, thank you. Thank you for all you
Thank
do.
you.
Thank you. Representative Kafia.
Thank you, Madam Chair, and thank you for your testimony. I guess I want to follow up on my colleague Rep. Schmaltz's question. Do you measure and quantify this over time? Essentially the number of incidents in which you need to intervene where someone is in the middle of a mental health crisis as a department. As we're trying to understand the scope of mental health crises in our state, this feels like potentially an important set of data.
I appreciate the question. That's a very good question. It's something that I would have to go back and look at. We do track every type of complaint through a record management system, and I'm sure we could glean that information. Being the chief, I get what's called administrative notifications anytime there is a critical incident that happens in the state, because speaking really to the question on mental health for our officers, we don't have the officers elect to see professional help. In every critical incident, we mandate that they see professional help. And I can tell you that these events are weekly. They are increasing. And I think it's just talking to colleagues in law enforcement. My brother was an inspector with the state police. It is regretfully stressful times. And we're seeing it. And it's not just Southeast Michigan. That's the point I want to get across. It's statewide. It's not unique to cities. So thank you.
Thank you. I think we have several members interested in the data, so if you could look at that and then maybe send me, and I'll send it to members, a report about the statewide scope of this and maybe a trend over a couple years, that would be greatly appreciated. My last softball question for Senator Cherry is, was this real contentious over in the Senate? What was the vote total?
This was not contentious in the Senate. It did pass out of the chamber unanimously.
Thank you. Thank you, gentlemen, for testifying with us today on this important matter. I do plan to take it up for a vote next week.
Thank you.
Representative Neely moves to excuse absent members. There being no objection, the motion prevailed by unanimous consent. There being no further business before the committee will stand adjourned.